Dallas Renal Group provides comprehensive kidney care including transplant and home dialysis services. Information can be found on the DallasRenalGroup.com website or the Dallas Renal Group Facebook page. It is also sponsored by VCare Home Health, a leader in providing home health care services throughout the entire DFW Metroplex. Folks, my name is Dr. Parin Mikadia, and I will be co-hosting today's show with Dr. Vic Prakash. You can watch us live on our Facebook page, and after the show, head over onto our YouTube channel, Doc Talk Live, and like, comment, and subscribe to see the great shows we have scheduled in the upcoming weeks. Folks, more details can also be found on our website, doctalklive.com. And if you are a healthcare professional and would like to be on our show, please send us a request through our website or through our Doc Talk Live Facebook page.
This is Dr. Vic Prakash, your co-host of Doc Talk Live. Today, ladies and gentlemen, we have a very important show for you. Did you know 1 out of every 2 American adults aged 30 and over has periodontal disease? In adults 65 and older, the prevalence rate increases. This high prevalence rate among adolescents, adults, and older age groups makes it a public health concern. The topic of the day is periodontology. We have Dr. Rishika Kapoor Menon and Dr. Randhir Kapoor here with us to discuss periodontics. So to be a part of the conversation, give us a call, 972-235-5555. Again, that number is 972-235-5555. We'll be happy to take your live questions throughout the show. Dr. Rishika Kapoor Menon and Dr. Randhir Kapoor, welcome to Doc Talk Live. Thank you both so much for volunteering your time to be a part of our show. And tell our listeners a little bit about yourselves.
Well, thank you for having us here. Hi, everyone. I'm Dr. Rishika Menon. Thank you for having us on Doc Talk Live. I've been practicing periodontics for the past year. I actually joined my father, Dr. Randhir Kapoor, in practice last May. We're here in the DFW Metroplex. We have a few locations. We are in Keller, Irving, and then Dallas proper. For more information about us, our website is PerioLife.com. We also have a Facebook page, so check it out, like it. It's under PerioLife Periodontics.
Dr. Kapoor?
Hi everyone, my name is Dr. Wendy Kapoor and I have been in private practice for about 20 years in Dallas Metroplex. I practice out of Keller and Irving, and we recently started a new office in Dallas. To reach us, please call me at 817-741-GUMS. And thanks for having us here.
Thank you both again for being on our show. Dr. Menon, let's dive right into our topic. Can you tell us a little bit more about periodontics and how it is different from regular dentistry?
Yes, absolutely. Periodontics is a dental specialty. We focus on the health of the tissues around the teeth. So that includes the bone and the gum tissue around teeth. We deal with the treatment of gum disease and bone loss around the teeth. This is primarily a surgical specialty focused on maintaining the foundation of teeth and also the replacement of teeth if needed with dental implants.
Dr. Kapoor, what are some common causes of gum disease?
Gum disease is caused by bacteria in the mouth. The combination of food debris, bacteria, lead to the formation of plaque, which causes inflammation of the gums. Inflammation of the gums with the bone loss we call periodontitis. However, without the bone loss we call it gingivitis. When the plaque calcifies over time, this leads to further worsening of the inflammation and cause bone loss. With the bone loss, the condition becomes periodontitis or periodontal disease.
Excellent. For the folks who are joining us, you're listening to Doc Talk Live, and we have Dr. Menon and Dr. Kapoor on the show today, and the number to the studio is 972-235-5555. Dr. Menon, can you give our listeners some tips on preventing gum disease?
Yes, absolutely. It's something we get asked all the time. What you do at home actually is the most important factor. Brushing twice a day and having effective brushing and also flossing every day is very important. Removing that plaque buildup from food debris on a daily basis will actually help prevent this inflammation. I generally recommend the use of electronic toothbrushes. I really like Sonicare. Oral-B is also out there. It's a great product. And they're very effective in cleaning teeth. If you're using a normal toothbrush, it's very important to use a soft toothbrush. Just fun fact here, actually medium and hard bristle toothbrushes are a consumer-driven product. they actually are not effective in cleaning teeth. They're great for tile grout, but not for your teeth. And so it's really important to make sure you have a soft toothbrush, because it can actually really get in there and clean between your teeth and gums. Also, the other thing is make sure you're angling your toothbrushes kind of in between your gum line and your teeth, so you can actually clean into the gum pockets. Also, the other thing is it's important, go in for your 6-month checkup with your dentist or your periodontist. From there, they can actually identify and treat gingivitis before it progresses and gets worse to periodontal disease.
All right, we're getting some live callers. Hey, you're on the air with Doc Talk Live. What's your question?
Yeah, my question is, you know what, I'm 70 years old, and I got some dental problem. I did my dentures at home in India, and it has come on, and up and down.
Okay.
So, the dentures can be repaired. That is the only question I have.
Yes, they can be repaired. What you have to do is you have to go to a dental office, or you can very well come to us so we can look at it, and then sometimes they can be relined, but we have to see the condition which they are in before we can tell you if they can be repaired or not.
Let's take another caller. Hey, you're on the air with Doc Talk Live. What's your question?
Hi, thanks for taking my call. My question is, I lost 2 teeth like 10 years back. Like I'm 40 years old. I didn't replace the teeth, those 2 teeth. Just want to know, like, will there be any side effects in future, or is it good to replace new teeth, or is it I can live like that? I just want to know that. Thank you.
That's a great question, and something we get asked all the time. So the thing is, especially if it's a tooth in the back, they are very important. The way you chew, the way you speak, missing teeth can really affect that. And the other problem is, for example, if you're missing teeth, the teeth that may be opposite it, whether it be on the upper or the lower, they actually can move and migrate downwards and cause more problems, more bone loss. And sometimes it gets to the point where, you know, replacing those teeth becomes more and more difficult. So if we can treat the missing teeth early on, it's definitely better long term.
We've got one more call. Hey, you're on the air. What's your question?
So many dentists opening their offices, like in every corner you see, and sometimes you see like two dentists staying side by side. So how do we pick which dentist is a good one to go to? Because apparently a lot of them are just opening dentist offices. So can you please help?
Yes, absolutely. I know, especially I know in that Plano Frisco area, we've got a lot of dentists nowadays, all over actually. Well, the way to look at it, so there are general dentists, ways to look at, you know, just to make sure they're licensed. You can also look at the American Dental Association website to see, you know, their information there. The other thing is now, if depending upon what your needs are, you may need a specialist. And so there are certain dentists, like myself and Dr. Kapoor here, we've both gone through specialty training and have been certified. And so depending upon what your individual needs are, you would be seeking different specialties. I know that there are a lot of what we would call chain dentistry, which they, you know, have a lot of great dentists. There's a lot of private practice dentists as well, but I guess the short answer to your question is, you know, check with your friends and family who they've liked. That's a really good way to go with it. And of course, look them up online, just check their credentials. And then from there, it's a very personal relationship. So someone who you work well with will probably be the best provider for you. Everyone's a little different in that aspect.
We've got more calls. It's lighting up. Hi, you're on Doc Talk. What's your question?
I just had a question related to cleaning. So for the periodontal treatment, right, when we go for like regular cleanings, right, does it weaken the bones, or does it have any other issues?
No, it doesn't weaken the bone. When you go for the periodontal cleaning, we usually go much below the gum line, clean it. Sometimes you may have heard deep cleaning. So it doesn't weaken the bone. It actually helps in resolving the inflammation and restoring health.
Hey, you're on the air. What's your question for our experts?
The first one is, what does sensitivity to cold water, cold or room temperature water indicate? And the second question is, why is there sensitivity to cold water and not to hot water? Warm water, I mean, rather.
Okay, so a couple things. Now, as far as sensitivity, it can be several things. So that's why it's very important to go in for those regular checkups. Now, cold sensitivity a lot of times can be inflammation of the gums. It can also be inflammation of the tissue inside the tooth, which is called a pulp. Sometimes if there's, large decay or a big cavity, it can cause inflammation inside the tooth, and the way that we perceive pain in teeth is actually cold and hot sensitivity. Now, everyone's a little bit different in the way that they react. Sometimes certain people will feel more cold sensitivity versus some people that will feel more heat sensitivity. The other thing is something that's pertinent to our specialty, which we see quite a bit, is receding gums. A lot of times the exposure of the root surfaces, because the root surfaces are a little bit weaker and softer, they actually perceive a little bit more temperature sensitivity. And so sometimes that can be the issue, and especially even there can be some gum recession because of underlying periodontal disease. So like I said, it's just very important to get that checked out, and then from there a proper treatment plan can be outlined.
Okay, we're going to take one more call. Hi, you're on the air with Doc Talk Live. What's your question? Let's try again. Hey, you're on Doc Talk. What's your question?
Thanks for taking my questions. I have questions related to water peak. I was using normal floss for flossing my teeth, and I started using water peak since last 2 months. But what I observed that with the water peak, it is having more bleeding in my gum. So is it safe to use water peak? I don't know. Like, which one is better?
Okay, so actually water picks, they're a great tool, but unfortunately, even a lot of the studies that are out there, they actually are not very effective in cleaning around the teeth, in between the teeth, like floss is. But at the same time, the fact that there is bleeding when you're using the water pick, that can also be a sign that there's already some inflammation that maybe needs to be treated, in order to support your home health. So definitely, again, get that checked out, so that we can form a proper treatment and get you the care that you need.
Folks, you're listening to Doc Talk Live. If you're just tuning in, we have Dr. Kapoor and Dr. Menon in studio with us discussing periodontics. We're about to head into our 5-minute break, but we've had a lot of callers. If you didn't get through the first time, keep calling. We'll catch you during the break, and we'll get to your questions as soon as we come back on air.